Hello, and welcome to Diagnosing the Barriers, a podcast by Physicians for Human Rights Israel. I'm your host, Haya Abouardi. In this podcast, we bring you voices from the ground, PHRI staff, volunteers, and partners, as we explore how health intersects with power, inequality, and resistance. We'll take you beyond headlines to understand the real-life barriers to health and the collective struggles to overcome them. It has been widely documented that Gaza is facing a catastrophic humanitarian crisis and that the Palestinian healthcare workers and hospitals have been among the targets of Israeli military attacks. But what has received far less attention is what this reality means for pregnancy, childbirth, and early life, and for women whose bodies are expected to sustain life under conditions that make survival itself uncertain. Today's episode brings together two reports, one by Physicians for Human Rights and one from Physicians for Human Rights Israel. Researched and written independently, the two reports document from different perspectives how the systematic erosion of healthcare, nutrition, and safety in Gaza has undermined women's survival across the reproductive life cycle, from menstruation to fertility, pregnancy, childbirth, and postpartum recovery. With us today is PHRI's Executive Director, Sam Zia Zarifi, and from PHRI, Lama Bakri, Project Coordinator at Occupied Palestinian Territories Department. Thank you both for joining. Between May and June 2025 alone, Gaza's Ministry of Health reported a 41% decrease in birth rate compared to the same period in 2022. More than 2,600 miscarriages, 220 pregnancy-related deaths before delivery, and a sharp rise in newborn deaths, including at least 21 babies who died on their first day of life. I want to begin with PHRI's report that centers the voices of pregnant and breastfeeding women themselves. Lama, your report is grounded in in-depth interviews with pregnant and breastfeeding women in Gaza. I want to ask you, was there a story or a moment from those interviews that for you captures what motherhood under fire really means?
Thank you for having me, Haya. Of course. As mentioned in the report, I've interviewed 21 women. To be completely honest, I think I've had many striking moments with different women regarding specific parts of their stories, but I think one of the most striking stories I've heard was of a young mother, a 20-year-old mother. Her name is Maha Yunus. She was 19 when she discovered that she was 4 months pregnant. And she was basically pregnant in her 4th month of pregnancy and when the war began. In the second day of the war, her building was bombed, and her and her husband and her husband's family were basically buried under the rubble of their house. Miraculously, she survived, and she had some head and back injuries. They went to the hospital, her and her family relatives, to find the hospital completely overwhelmed with cases of injuries and deaths, and most of them chose to go back home and to basically remove the sharp glass shards from their bodies and their faces, while one of her family members was hospitalized. Immediately afterwards, they displaced to the south of the Gaza Strip, leaving everything behind. Obviously, they didn't take any of their belongings. On the way to the south, Maha discovered that she was bleeding heavily, and she had to stop with her husband in the closest hospital to check on the babies, on her embryo's health. The doctors assured her that everything is okay, but that she needed to continue to do casual checkups to see if the baby was actually in good health. This didn't happen due to the overcrowdedness and basically the prioritizing of much more severe cases who got to the hospitals. And Maha had to wish for the best. They've displaced for up until our talk, which was in February 2025, they've displaced 5 times, looking for safety and security and following the orders of the Israeli military on the ground. Prior to her childbirth, she was diagnosed with 3 types of sinuses that needed to be surgically removed and cleaned. She went through this surgery with no anesthesia at all, and it was not fully fixed. She had to go after giving birth to her baby daughter to go over another surgery, basically. So yeah, in March 2024, she gave birth prematurely in a field hospital next to the Miskin Layan camp in Mawasi Khan Yunis. And she had severe pregnancy complications. Childbirth complication. The water turned darker, and they had to basically get the baby out as fast as possible. At birth, the Maha basically required surgery, but couldn't receive it. So she shared with me the talk that she had with the midwife and the doctor who were there. And I think to me, this symbolized how, like, if we were to hear such conversation, not knowing the context in which this happened, it would be like we'd be very worried about basically the what this hospital can provide. Like she needed anesthesia, and there was no anesthesia to be administered to her, and the doctor and the midwife had to basically try to ease her pain and told her, like, please help us help you, uh, just by using breaths and trying to calm her down, to go over this process. And her baby daughter was born with low birth. Her birth weight was low. She continued, obviously, to talk later on about the process of trying to secure baby formula or milk for her daughter, which was like very, very expensive. And Maha herself lost over the 2 years 17 kilograms. So I think overall it encompassed the 3 main conditions that our report focused on. The first one, and the most important probably, was the destruction of the healthcare services and reproductive and obstetric care. The second is for the forcible displacement and the repeated forcible displacement. And the third is the policy of starvation that the Israeli military has imposed on Gaza.
That story really brings together a lot of layers of the conditions and pressures that pregnant women are living under in Gaza. Sam, I want to bring it to you now. Your report analyzes exactly this kind of compounding effect, how the destruction of health infrastructure, restriction on food and medical supplies, and even lack of baby formula interact. So I want to ask, from a clinical and humanitarian perspective, how do these conditions combine to undermine the most basic process of reproduction and survival?
Thank you, Haya, and thank you, Lama, for sharing the research, the incredible research done by PHR Israel. And it's exactly this kind of research and the story of Maha that we heard, of course, was repeated and replicated thousands of times. Physicians for Human Rights had independently uh, begun looking at this situation in Gaza, along with our partners at the University of Chicago Law School Global Human Rights Clinic. We've looked at the impact of attacks on health on women and children, and the UN Commission of Inquiry had already highlighted that the attacks on the healthcare system had a disproportionate impact on women who were getting pregnant, who were pregnant, and on newborns. So we spoke with about 78 health professionals, international health professionals, who were on short-term medical missions. And we especially wanted to see what the situation was in 2025 because there had been a ceasefire in place. And as Lama mentioned, what we found is that the large-scale destruction of the healthcare system in Gaza, including facilities that are designed to provide reproductive and maternal care, combined with the restrictions on food and the malnutrition that caused, and compounded by the restrictions on basic medical supplies, including antibiotics, anesthesia, pain medication, specialized baby formula, had a horrific impact on women who were getting pregnant, who were pregnant, on mothers. You already cited some of the figures that have come out from the Gaza Ministry of Health. These are the best figures we have, of course, because outside access is blocked. These figures have generally proven to be fairly accurate, and they show a distinct drop in birth rates and a rise in significant harms during pregnancy and to newborns. And the story we heard from Maha really shows how really at this point, for women who are getting pregnant, who are pregnant, and who've just given birth, for newborns, conditions in Gaza are almost medieval. Really simple procedures are blocked, and we heard this over and over again from some of the clinicians we spoke with, that they faced really, impossible situations. Clinicians spoke to us about the impact of malnutrition. Many, if not all, of the patients that they saw, the mothers were suffering from malnutrition. As a result, children were far more vulnerable to huge problems. But these are issues that medical science has been able to deal with, including in war zones, including in areas of conflict. But because of the huge malnutrition, children were simply and mothers were unable to provide a lot of the basic biological functions that they needed to survive. And what is needed in many cases was specialized baby formula. Again, this should be widely available, but they were not available, again, as we heard in the case from Ma. And we have asked the Israeli government about why There are restrictions on medical-related supplies. We've been told that these are potentially dual-use restrictions, but the result is that over the period that we saw in 2025, there was a completely foreseeable and avoidable massive and systematic level of harm to mothers and to newborns. This was something that multiple humanitarian organizations, including the UN, raised with the Israeli government. And nevertheless, the situation has not improved. So looking back, of course, this is what we were able to account for. The issue is that even today, after the ceasefire, after the creation of a board of peace, we haven't seen the kind of attention that is necessary. More food is getting in, but when you're dealing with this kind of malnutrition, especially for newborns, it's not just a question of throwing calories at them. They need specialized diets, and they need their health infrastructure to be rebuilt, and we still haven't seen that. So what we were able to document at a general level was multiple instances of the kinds of stories that you heard about Maha and that PHRI documented, and looking ahead, unfortunately, still a failure to respond to the mothers and the children who have been harmed and who continue to be at risk.
There's this clinical part of describing the shortages, what it leads to, and the policy behind it. But I'm also interested in hearing, how did women experience this compounding effect in their own bodies? What do they report about emotional, physical, and psychological impact and the reality that they live?
I think one mother's, I'm gonna quote her, I think this sentence stuck with me a lot throughout the interviews, is she told me towards the end of the talk that this is the tax of being a mother. I think PHRI chose to focus on mothers, pregnant and breastfeeding mothers, after our genocide report that was published in July 2025, was that we came to this report not wanting to prove much as how, like, we wanted to see how the conditions of life that were imposed and still are being imposed on the Gazan people in whole, and on mothers and daughter and their children more specifically, how these conditions of life have really caused the deliberate destruction of the Gazan people in whole or in part, either like physically or psychologically. Our focus was to see how these conditions translate into their everyday life struggles. Mothers have struggled in all aspects of life, especially after the loss of almost 1 in every 7 fathers in Gaza have been killed, and we know that 17,000 women in Gaza are widowed today. So that means that the effect of being the caretakers of their own families, whether it's through separation from, we remember the period where the North was separate from the South, and how that also separated whole families, and the ability for mothers to at least take a more caretaking role with their children, while the fathers go out to search food or anything that they can provide for the family. We know that the family unit also in Gaza was very much affected. But more than that, this orchestrated reality where, like, it's one thing to deal with starvation and to deal with its different levels, because the Gazan people have went through different phases of hunger and food insecurity. But it's a whole another level to deal with it when there's no access to services and hospitals that are meant to basically treat and um, to give the people what they need when they're dealing with starvation. And it's another when you have to bear the physical toll of over and like repeated forcible displacement, where you have to build your life all over again. Many people, when they left their houses or their tents even, they had to buy tents once again, and the prices kept going up and up, whether it's food, whether it's tents, or any other supplies that people needed throughout the past 2 years. We've heard the prices of diapers, they're crazy. Like it reached 300, 400 shekel per diaper during different periods. So mothers had to prioritize their babies' needs. I also heard stories of mothers having to portion each like meals for their babies to at least have one meal a day. These are decisions that they were forced to take. It's not resilience. These conditions, they're very harsh, very deliberate in the way they've been put in place and kept even after the ceasefire. We know that the immediate deaths of Gazans have stopped, but the long-term effects of what's happening today, of the restriction of food and rebuilding materials and everything that's needed today to rehabilitate and rebuild is non-existent. So what we worry about is the long-term effects of what's happening today.
Yeah, what you're describing isn't simply the absence of care, it's the convergence of policies and attacks that collapse the environment needed to sustain pregnancy. Sam, your report situates restrictions on medical supplies within a broader context of systematic destruction of conditions of life. Based on clinicians' testimonies, what does that mean in terms of long-term harm, not only to fertility, but to women's overall survival?
The impact of the destruction of the healthcare system in Gaza is quite severe. Most of the healthcare system in Gaza has been severely damaged, and that includes, as far as we know, every facility specifically designed to provide maternal and reproductive care, and that has tremendous clinical results. Beds and spaces are very, very difficult to come to. Clinicians were repeatedly facing very complicated, impossible decisions. They had to decide on triage, basically, on whether a newborn that was severely underweight, that was suffering from harms caused by malnutrition, for instance, could be saved. Again, these are problems that are easily responded to within our existing medical capacities. But the absence of food and the absence of medical facilities meant that physicians had to sometimes take decisions that meant that they wouldn't be able to provide care for mothers or for newborns, and that is, of course, quite horrific. We've seen multiple instances of attacks on healthcare facilities. Just a reminder that Physicians for Human Rights works around the world on the norm prohibiting attacks on healthcare in times of conflict. And what we've seen in Gaza since the attacks of October 7th was a very high degree of systematic attacks on healthcare systems. The damage to the population is clear. The Israeli government has stated that these attacks were due to the militarization of facilities under international law. That's a very narrow loophole, I guess, legally, that would allow a particular healthcare facility to be attacked. Maybe these facilities were militarized. The absence of any independent investigation means that we don't know. And of course, it's alarming that we haven't seen any proper further evidence of this coming from the Israeli government, including, say, prosecution of healthcare workers who were at times detained from these facilities. And I have to say that we were very aware of this statement. We asked all of the healthcare professionals who had come out of Gaza whether they had seen evidence of militarization, and we did not receive any evidence of that. That's not determinative, but it is a strong indication of this. But the impact of the destruction of the healthcare system means that this really became a question of long-term health. We've heard and we've documented about the impact of malnutrition and lack of medical supplies on thousands of women and of newborns. And we know medically that the impact of such harm is long-term. It can be alleviated if necessary supplies, especially baby formula for the newborns, is provided. But the impacts are physical, the impacts are mental, and they're psychological and traumatic. And we haven't seen yet, despite the ceasefire, the proper degree of attention and assistance to women and to children. It's absolutely essential that we restart the building of that medical infrastructure, that we start seeing some more facilities and more medical supplies being made available. And we haven't seen that at all so far. And this is at a place where the UN Security Council has stated that these things have to be made available. So what we have is a widespread crisis that impacts thousands of women and children, and that is still not being responded to properly. And again, to say that this is not at all necessary. We have worked in other conflict situations around the world where the protection of healthcare facilities and the protection of women and children, which women and children are given special protections under international laws of war. It's possible. It is possible to conduct a war without this level of damage to women and children, and we haven't seen that, and we're not seeing the responses that are necessary right now.
Can you tell us more about your findings and your research in other countries?
Physicians for Human Rights documents attacks on healthcare around the world, along with our partners. And an unfortunate truth is that over the last 10 years, year after year after year, we have seen an increase on attacks on healthcare. A reminder that the prohibition of attacks on healthcare is literally the first item historically 150 years ago that led to the creation of the laws of war. And we have seen that norm being violated most systematically, we saw that by Russian and Syrian forces in the context of the Syrian civil war. Then we've seen it in Ukraine, again by Russian forces. We have seen it in Ethiopia, in Sudan, in Congo, in Myanmar. So the reason we have the norm prohibiting attacks on healthcare is because the impact is devastating. The impact on the civilian population is devastating. And as we have seen in Gaza, it's not just about a single attack on a clinic and the possibility that that may take out potentially a few enemy combatants. The impact of such attacks goes far beyond that, predictably. So in terms of the principles of the laws of war, that is discrimination about not harming civilians, proportionality of the harm to civilians versus the military necessity of an attack, and the principle of precaution, that you have to take all the possible precautions to not harm civilians. We've seen all of those really violated. Again, this is a global phenomenon, but the IDF is a highly trained and experienced military, and it is surprising and disappointing to see this level of violation. Let me speak about it, the phenomenon a little bit more broadly. You know, when you attack a healthcare clinic, it's not just about that immediate attack, especially for reproductive care. What that means, as we've documented, say, in Syria, in Ethiopia, is that women who are pregnant, newborns, are unable to access that clinic. They're unable to get the health care that they need. So the impact goes far beyond just the few people who were in that clinic who may be harmed at that particular moment of attack. It captures a whole population. And that's why in its most recent guidelines, the International Committee of the Red Cross and Red Crescent, the ICRC, which are the holders of the development of international law, have made it clear that when you're attacking a clinic, it's not just about that momentary advantage that you think you may get, but you have to take into account the impact that such an attack will have on a population. And for instance, if you know that a clinic is the only facility providing healthcare to women and to children, you have to take that into account. And this is a warning that was provided to the Israeli military and the Israeli government immediately. And it's you know, where we are, especially as we saw in 2025, is that despite these warnings, that we've seen multiple attacks on healthcare facilities. And again, the statement is that these were militarized. If so, let's investigate them. If Hamas or other militants did militarize this, let's bring them to justice. But we haven't seen that evidence, and the impact has been horrific, and the impact has been aggravated by the restrictions on medical supplies and on food coming in. And so the result is, as we've seen around the world, that militaries are increasingly attacking healthcare facilities because it's a very effective way of degrading a civilian population. But degrading a civilian population is such legalese. The real impact is what we heard from the research done by PHR Israel. The real impact is what happens to mothers who lose a child, who give preterm labor, but their children can't get support. It's to newborns who are underweight and malnourished. So our research around the world has documented this phenomenon, and it's quite unfortunate that Gaza has become one of the places where these kinds of attacks have been documented, and where we're able to see the impact, unfortunately, very clearly in the misery and the grief that was entirely avoidable, but we've been able to document right now.
Mm-hmm. Lama, I want to come back to you. Your findings show that the deliberate erosion of conditions necessary for a safe pregnancy has led to a staggering rise in high-risk pregnancies. But I want to ask, what do these numbers look like in the life of a single woman trying to carry a pregnancy to term under these conditions? And what do the personal aspects of these women's testimonies show that the numbers and statistic cannot?
Let me start with the second half of your question. I think it's very easy to recite these numbers in the news, in UN, like for everyone who's been like me, who's been following the situation for the past 2 years. It's really hard to really imagine how life, and even after hearing these stories from the women themselves, it's not anywhere possible, like close to what the actual experience is. But I think how, like, the most striking thing was the devastation, the helplessness, the feeling that, Gazans have always said in the past 2 years, like, where do we go? We saw a lot of videos of them saying, like, where do we go? What do we do? Like, who do we ask for this to stop? In a way, the civilian population, their suffering, their everyday life suffering. I think it's like literally waking up in tent camps, and I did speak to some of them in the past few months, and now with winter, stories of damaged tents, flooded at night, having to wake up their children to deal with that, only to fix it somehow, or to manage to spend the night, somehow to wake up the morning after, to go and get the salt water for washing the clothes and for everyday, like, cleaning the dishes, and then to go for the sweet water, for the drinking water, also with gallons to fill them and get back to the camp. Having to be okay with whatever the community kitchens, if they work, whatever you receive is good enough. Like, we also heard stories of mothers who had to start feeding their babies food that's not appropriate for their age, to feed them something. Some mothers who were under, like, I spoke to 2 mothers who were in 2 UNRWA schools, during a siege. We remember the sieges of hospitals and schools for days, only then to be to let the people leave the school in corridors that were declared safe, but many of them were bombed, and where civilians were attacked passing through them. So 2 of these women said that they chose to continue breastfeeding their babies because they were afraid that in case of a siege or a raid, making or preparing the formula, which would need heat, like you need to set some fire or something, would like trigger a reaction from the Israeli side. Yeah, so like, I think the statistics of, like, I don't know, the drop of the number of births from 2022 to 2024. We know that there's only 17,000 recorded births, or that 2,600 reported miscarriages. I think, like, looking at some of these cases, hearing some of these stories, really made me understand more how dangerous it was to be a pregnant mother or to be a lactating mother. Like, it really caused disproportionate levels of harm on mothers and pregnant women more than the civilian population. And obviously, there are other vulnerable communities who were also under disproportionate, who suffered disproportionately from the harms inflicted on all the civilian population in Gaza.
Mm-hmm. We're a bit short on time, but I want to ask both of you, given all that was explained in this episode, what does accountability look like? Not only in terms of investigation and prosecution, but also in terms of remedies and reparations for survivors and families.
For me, it would mean the immediate, uncontrolled, unrestricted entrance of aid and building materials to rebuild Gaza. We know that temporary housing that was used in previous wars was not a solution, but even this is not allowed at the moment, and it's not getting in. Obviously, unfortunately, we know that locally and internationally, the system that has been working for decades is now falling apart. We know that the 37 international humanitarian aid organizations today are forced to, under the registration law, to basically give the data of their workers, whether Palestinians or internationals, and their family relatives. I think accountability at the moment is a very far concept given the circumstances in general. But what we have been calling for is to end the policies of starvation and the denial of medical care in the Strip, and to stop the violations, to allow in and to let people out, whoever wants, like, medical permits, whoever needs to be let out should be able to go out and receive the medical care that they desperately needed during this war. We would love to see the enforcement of the protections of mothers and children under international law, and we call for the raising the pressure and pressuring Israel to allow the people of Gaza to their right to go back to their lives, to live in dignity, and to be able to care for their children.
Sam?
We know that the only way to stop the global erosion of the norm prohibiting attacks on healthcare is through accountability for such attacks. These are international crimes. These are violations of the laws of war. These are crimes against humanity and huge violations of human rights. So there has to be some accountability. I have to remind everyone that there are standing provisional orders from the International Court of Justice demanding that conditions in Gaza be consistent with humanitarian needs. And I think what the research from these two reports has shown is that they are not. There has to be accountability for what has happened. And I want to remind again everyone that if it is the case that the attacks on healthcare facilities, for instance, were caused by Hamas, or that medical supplies were stolen by Hamas, these need to be investigated. Let them be brought to account. But the situation right now is that we simply do not have that kind of information. But justice is one part of the rights, the international rights, human rights of the people in Gaza, and the other immediate thing is humanitarian assistance and response. We're very pleased to see that the last Israeli hostage has now been released. Of course, the taking of hostages in conflict is a serious international crime that demands justice. But with that release, there is really no excuse for the ongoing restrictions that we are seeing. And as we've heard, we know that there are immediate needs for thousands of mothers and newborns, and we know that these mothers and newborns will need ongoing support to prevent even worse long-term harm to them. So as we've heard, the pressure being put on organizations like MSF, Médecins Sans Frontières, who have been providing a huge and necessary part of the healthcare response in Gaza, is a significant mistake. We find this really utterly irrational and utterly at odds with the demands that are necessary from the Israeli government, from the Board of Peace that has now been given the mandate under the UN Security Council to provide assistance. And so we need to see some accountability for what has happened, and we need to see whoever is responsible. And we need to see immediately the provision of aid, especially for mothers and for children who are facing a winter and who are still facing the lack of sufficient healthcare facilities and healthcare supplies and sufficient food, especially for newborns.
Mm-hmm. We have come to the end of our time. I want to thank you both for your input. For me, it really helped me understand what protection and reproductive justice in armed conflict is all about. I want to close this episode by a personal note. International organizations have warned time again that attacks on reproductive health facilities and restrictions on food and medical supplies were intentional and systematic, resulting in devastating harm to reproductive capacity in Gaza. And yet, despite the unique protections for maternity under the Geneva Conventions, and despite decades of international law recognizing the special status of expected mothers, accountability remains elusive. It's striking that while sexual violence in war rightly commands attention, obstetric violence and the destruction of maternity conditions does not bring the same attention. Thank you again, both. I want to add that if you found this episode insightful, I ask you to please share it with others and subscribe to us wherever you listen to us from, and leave us a review.